I'm Belinda Cochrane. I'm a respiratory and sleep physician who practices in Campbelltown Hospital mainly, that's in southwestern Sydney. Before we talk about pneumonia, what I'd like to say is that I'm talking to an audience of people who have various different lung diseases, and the lung diseases that you have are all quite different. So it's hard to give you recommendations that will suit all of you. And it's really important that if you're worried about symptoms, including worried that you might have pneumonia, that you should always consult your own doctors about your specific lung condition. Generally, pneumonia results from an infection in the lungs. Now, the lungs have airways which branch into very small airways and eventually into air sacs that are used for gas exchange. The infection that's we call pneumonia is actually infection not in the airways but in the actual air sacs, where the lungs try and take the oxygen from the air and transfer it into the bloodstream. In terms of what causes pneumonia, the infection type, pneumonia is caused by various germs. Now, in the recent pandemic, you will have heard a lot about viruses, in particularly SARS-CoV-2 or COVID-19. So viruses are an important cause of pneumonia, as are bacteria, which are the common germs that we use most of our antibiotics for. You can also get pneumonia from other things in the environment, like fungi. Some of you with lung conditions might have been diagnosed with a pneumonitis type condition or have been told that you have organising pneumonia. Those two things are not exactly the same as what we call pneumonia. Organising pneumonia, although we use pneumonia in the name, is not an infection, and it's not really a pneumonia in the true sense of the word. Pneumonia is probably more likely to occur in people who are at the extremes of age. So people who are either very young or getting quite elderly. The other thing which is relevant to perhaps most of this audience is that if you have abnormal lungs, particularly if the structure is abnormal, you may be more prone to pneumonia. The other reason that you might be more prone to getting pneumonia is if your immune system doesn't work properly, because your immune system is supposed to act to try and protect you against any infections anywhere in the body. And if your immune system doesn't work, that means you're going to be a bit more vulnerable. So that includes also people who are taking medication that suppresses the immune system. So some of the audience here may be taking corticosteroid medication, commonly known as steroids, or other immune suppressive medications, and they will also potentially make you more prone to infection than the average person. The short answer to that is yes, pneumonia is contagious. However, for some types of germs involved in pneumonia, we're more worried than with others. So people who have bacterial pneumonias, with one major exception, we usually don't worry too much about your risk of transmitting the pneumonia to other people. And we also know that many people do carry the germs, and in this case it's bacterial germs. We know that they actually have bacteria carried or living in their upper airways and sometimes in the throat anyway. So for many people, it doesn't cause pneumonia, and so we don't actually worry that much about contagion. However, with the viruses, they're all quite contagious, and you can quite easily transmit them from one person to another. In terms of how long you might be contagious for, it does differ. So as I said, with the bacteria, for most of them, we don't worry too much about transmission, and general measures such as hand washing and keeping a little bit of distance will usually work. In terms of viruses, it's a bit of an inexact science. We think you're probably infectious for most of the viruses a bit before you actually get symptoms, so that's a bit tricky to avoid. Certainly in the early stages, when you start to get symptoms, you're usually highly infectious. And usually as the symptoms wane, you will become less infectious with time. So that might be 5 to 7 days. It might be longer for people who have a suppressed immune system because they may not eradicate the virus as quickly as others. Generally speaking, if once you've had a significant improvement in symptoms, you're probably okay and not too risky to other people. One of the important questions about pneumonia and people with lung disease is whether we can actually prevent pneumonia in lung disease. We can't prevent it all, but there are some things that we can do that give you a good chance of reducing your risk. So for most people with lung diseases, we do recommend 3 different vaccinations. One of them is the annual influenza vaccination. One of them is the pneumococcal vaccination, which some of you will know as the pneumonia vaccination. And the other one is new kid on the block, the SARS-CoV-2 vaccinations. Now, influenza vaccination can actually protect both against influenza, but also against some of the bacterial infections, because we know that following a bout of influenza, there is a higher risk of getting pneumonia from a bacterial cause. So that's one of the reasons that we recommend influenza vaccination. It's not perfect, but we update the vaccination every year after we look at what happened in the northern hemisphere winter, and we do the best we can to have a vaccination that will cope with the strains of influenza, because influenza keeps changing every year. The pneumococcal vaccination, if you're not an Aboriginal or Torres Strait Islander, is not a free vaccination, but we still recommend that you get it if you can. Once you're 70 years old, it's free for everybody. Pneumonia can present differently in different people. So again, it's not that everyone has the same experience of it. Some people will have cough and sputum, or a change in their cough, or a change in their sputum, more sputum, different coloured sputum. Some people will be more breathless than usual. Some people will have fever. Some people will have chest pain, which is unusual for them. And the sort of pain that we usually associate with a pneumonia is often a pain that makes it difficult to take a full breath in, a sharp or a tearing pain. Usually enough to prompt people to seek advice, because it's really quite difficult to breathe with that sort of pain, and usually people do seek advice to try and get a resolution of it. One symptom that might not be an obvious one that a lot of people will have, and that's fatigue, and that's often not recognised as a sign of pneumonia. Now, to get a diagnosis of pneumonia, you need to have an assessment, probably both including a clinical assessment with your doctor or a doctor, and they will find out about your symptoms and your history. If you're in a hospital, they might take some blood tests to try and look to see if there's any signs of an infection in your blood. If you're just with your local doctor, that's okay. That's no problem. Your local doctor will listen to your chest, just like the hospital doctors will. And they can often, by listening to your chest, particularly if they've listened to your chest before, they might hear different sounds of your breathing and certain extra sounds that aren't usually there. The other thing that they might do is do some chest imaging, either a chest x-ray, and that's usually the first port of call, but some people, if your situation is complicated, they might do a CAT scan of your chest instead. Treatment for pneumonia actually starts out very similar to people who don't have lung diseases. So generally speaking, when you first present with symptoms to us doctors, we don't know what type of pneumonia it is for sure. So we don't know whether it's a virus or a bacteria, although we might make some educated guesses. And so what we usually do is decide whether we think it's most likely viral pneumonia, most likely bacterial pneumonia, and choose antibiotics to suit what we think is most likely. And if we don't know, we might cover both things. We usually get an answer about viral pneumonia fairly quickly. One of the things we do to check for viral pneumonia is a viral swab. Many of you may have had them. They usually take the swab from the back of the nose or throat or both to identify whether there's any virus present. So we can usually decide about viral pneumonia very quickly. And there are only a couple of viruses for which we have treatments available, and they're called antiviral. For the bacterial pneumonias, we often take a little bit longer to find out for sure, and sometimes we don't actually find a bacterial cause, even though we think there is one. And so what we do is a best guess, and our best guess covers the most common causes of pneumonia. So we will usually use a couple of different types of antibiotics. In the outpatient setting, you will often receive swallowed antibiotics, so you can take them at home and recover at home. If you come to a hospital, you may receive intravenous antibiotics, and that usually indicates you're either a bit sicker or that we're worried that you're not going to be able to swallow them. And that might be because you're having vomiting or something like that at the same time. Now, for people with a lung condition, we sometimes need to give oxygen because sometimes your oxygen levels are a bit lower than normal. There are certain types of lung disease. You might know that you have asthma or COPD or even emphysema. For some of those, when the doctor listens to your chest, they might think that you are tight and wheezy, and you might be having either an asthma attack or a COPD exacerbation. And so they might also prescribe you at the same time a short course of corticosteroid medication. One question that you might have is, how do I know if my pneumonia is severe? How do I know to get help in the first instance and where to go, whether to go to the general practitioner or whether to go to the hospital? So what we're talking about here is the signs that of pneumonia that might suggest that you've got severe pneumonia. Severe pneumonia can present in various different ways. One of the things to suggest that you might need intravenous antibiotics rather than just swallowed antibiotics is if you're having something called rigors. So you know about fevers or having a high temperature. If you have a high temperature and then feel really cold and get the shakes, uncontrollable shaking, that's what a rigor is. And in the setting of other symptoms that might suggest that you're coming down with an infection, in this case a pneumonia, that would be a sign that you should present to a hospital. In terms of pneumonia, two things that might suggest that it's a severe one and that you probably need some extra support in a hospital setting rather than outside is if you're much more breathless than usual, and if you've got chest pain, what we call pleurisy, pain that makes it difficult to take a full breath in. We know that if you have pain like that, you won't be breathing very well and you may well get worse with your pneumonia. So the signs of severe pneumonia: rigors, getting more breathless than you should be, particularly if you're struggling to do your day-to-day things at home, and that pleurisy. Now, one of the questions that people might have is, can pneumonia be a fatal disease? Sadly, yes, it can. But I want this audience to remember that actually it can sometimes be a fatal disease in people who don't have lung disease. However, it doesn't mean if you've got a lung disease that it's going to be fatal for you. It depends on a whole lot of things. It depends on how early you get treatment. It depends on how bad your lung disease is to start with. It depends on what other medical problems that you might have. And the other thing that it depends on is the type of pneumonia. It's very, very variable. It's not something that you need to worry about, that just because you've got lung disease, it's the worst case scenario. It's not. There's a whole lot of factors at play that need to be taken into consideration.